Growing global concerns about Donald Trump's mental health. Foreign media leads the conversation. In a notable shift, there has been a surge of international media attention on former President Donald Trump's mental health, with significantly more coverage emerging this past week than usual. Strikingly, this uptick in reporting is not coming from mainstream American outlets, but rather from international sources, particularly from the UK, Australia, and even Russia. The most unexpected and compelling coverage came from a Russian media outlet, which published a piece raising serious concerns about Trump's cognitive decline, a report that surprisingly echoed the concerns long expressed by American mental health professionals. The Russian article, provocatively titled "White House Patient: Why Psychiatrists Are Alarmed by Donald Trump's Mental Decline," detailed numerous warning signs and cited respected U.S.-based psychologists. Among them was Dr. Bandy Lee, the psychiatrist known for editing The Dangerous Case of Donald Trump, a 2017 book compiling expert concerns about Trump's psychological fitness. The article outlined troubling symptoms observed in Trump: increasingly incoherent speech, impulsive and inappropriate behavior, shrinking vocabulary, and growing reliance on profanity, all considered possible signs of early dementia. These cognitive red flags are said to be compounded by Trump's well-documented narcissistic traits and lack of empathy, forming a combination some mental health experts deem extremely dangerous. The Russian outlet further highlighted that Trump, who will turn 80 before the end of his term if re-elected, often brags about having passed the Montreal Cognitive Assessment, an MOCA. However, the article clarifies a key point misunderstood by many. The MOCA is a basic screening tool used to determine whether someone needs assisted care, not a comprehensive assessment of cognitive fitness for leadership. Experts note that many patients with early dementia can still ace this test, making Trump's boasting about it meaningless in the broader clinical context. Among the professionals cited in the article was Dr. Harry Siegel of Cornell University, who emphasized the accelerating deterioration in Trump's speech patterns and decision-making, particularly during public appearances. Siegel noted that even Trump supporters were reportedly unsettled by his increasingly incoherent remarks, such as his meandering commentary on childcare at a recent economic event. Another expert, psychologist John Gartner, criticized mainstream media for sanitizing Trump's speeches by editing out his most incoherent statements, a practice now referred to as sane washing. To support their case, the article referenced linguistic studies comparing Trump's vocabulary and rhetorical complexity from the 1980s to the present, showing a marked and measurable decline. Such findings have long circulated in academic and psychological circles in the U.S., yet they've largely been ignored or underreported by major American media outlets. This discrepancy in coverage leads to a broader concern raised by the commentary: why is serious reporting on Trump's mental health being conducted more thoroughly by foreign media? While independent U.S. journalists like Chauncey DeVega of Salon.com have consistently investigated and reported on Trump's cognitive decline, most major American outlets remain conspicuously silent or superficial on the issue.